Again, can I remind members that all committee meetings are held in public and are recorded, and that mobile phones and Blackberries will interfere with the recording equipment. So I'm asking members to switch off all phones. Under Chairperson's business, I want to remind members that we agreed financial scrutiny training session will take place this day week, Wednesday the 24th of September, in room 29 from 1:30 to 2 o'clock, and this will be followed then by the committee meeting in the Senate chamber, when officials will attend to outline the department's October monitoring round, and the training therefore is quite timely in that regard. I also want to remind members that the work of the expert panel headed up by Sir Liam Donaldson, which was set up to review the application of the health and social care governance arrangements, is ongoing. I'm seeking agreement to write to the department to request a written update on the work of the panel. The panel is due to provide a full report to the Minister by December 2014, but I think it would be appropriate that this committee sought a written update as to the current progress on it. Are members in agreement with that?
Right.
Bear with me. Members, I would also just raise one item that was raised today in the local press in relation to the increase in admin costs for the Health and Social Care Board of a 20% increase. And I know that the Royal College of Nursing and others have come out to question that dramatic increase at a time when frontline services, in particular, I suppose, district nursing and community nursing, seems to be fairly well cut. I would suggest and seek agreement, members, that we would write to the Minister and the Department to seek clarification if there has been that increase and the rationale behind it. Are members
Agreed.
agreed? In agreement?
Right.
Okay, it's also one other final item under Chair's business, and I beg your indulgence. The one item that has been brought to my attention is in relation to the Office of Legislative Counsel here in the Assembly, and some issues of concern of change to staffing arrangements that may indeed have an impact on what is considered a negative impact in relation to the mental capacity bill coming forward. And again, I'm seeking clarification from the Department, given the important piece of legislation that this is, and the fact that it is the single biggest piece of legislation that the Assembly will ever face. We need to get a sense of timelines, and there has already been a long delay in relation to bringing this forward. So I'm seeking agreement from the committee that we write to the Minister to clarify that there will be no impact in relation to bringing that legislation forward. Okay, members?
Within the term of this Assembly? Within the term of this Assembly?
Sorry?
Within the term of this Assembly? Is that the plan?
We were told it was to come out of this autumn or early next year.
Yeah.
Should be.
Yeah, it should be. But so we just need to seek
right.
those assurances that there's no undue delays. Okay, members. Item 5 is the draft minutes from the meeting on Wednesday, the 10th of September. Can I refer members to the minutes, which are at page 80?
Oh, yes.
Are members content with?
Madam Chair, there's under matters arising, item number 13. We did agree last week, as it says there, to forward a response on from the Minister to Mr Doherty in relation to accident prevention. Now, I've had correspondence from that person saying that he wasn't happy and he would like to address the meeting, the committee at some stage. Is there any possibility that that could be followed up?
Well, I think what we could do is ask Mr Doherty maybe to write back to the committee formally in the first instance on his issues, but I would suggest, and the member will know this, that it can be not appropriate for this committee to deal with individual cases at times, but happy to get the response back in writing to outline what Mr Doherty's concerns are in terms of the response, and we can reflect on it from there.
Okay, well I can advise of that. Thank you.
Thank you. Okay, so are members now content with the minutes from the 10th of September?
Right.
Okay, item 6 is the proposed amendments to the Safeguarding Board Regulations 2012. I want to refer members to page 89 of the meeting folder, for the relevant papers. Reminding members again that departmental officials attended last week's meeting to brief the committee on the proposals to amend the Safeguarding Board regulations to reduce the quorum requirements and to include a designated doctor in its membership, and to outline the results of the department's consultation exercise. The Hansard of that meeting, for members' information, is at page 3 of your table papers as well. Following the briefing, members had agreed to invite representatives of the Safeguarding Board here to give evidence. So I want to welcome Hugh Connor, Chair of the Safeguarding Board, and Sharon Beattie, Director of Operations at the Safeguarding Board. Just advising yourselves that the committee did take the evidence last week, as you will be aware, from the department on the proposed changes to the quorum of the board, and members were concerned about the reduction of the quorum on a number of levels. Concern in general around the decisions could be taken with 1/3 of the membership present, and also concerned about the perceived independence of the thematic review of what is a very critical piece of work going forward. So we've invited you here today to hear your views on the proposed changes on the quorum, the thematic review, and what you see as the way forward. So I'm going to ask Hugh, I'm assuming it is yourself, to make a 10-minute presentation, and then we'll open it up to members.
Okay, thank you very much, Chair. We're grateful to have the opportunity to present to you. Basically, I'm going to shape my presentation on 3 themes. 1, the regulatory change. 2, the makeup of the SBNI and the issue of independence. And 3, to update you on the work of the thematic review. One of the things I would say at the beginning, which I'll not cover but you may well wish to ask questions on, is that the Safeguarding Board, in terms of child sexual exploitation, is working at a number of levels, and the thematic review is just one. So we have a wider approach to that work, and I need to say that to you. Firstly, the regulatory change. Was a review of the regulations governing our court arrangements needed? The answer is yes. The reason is that approximately we have 70 to 75% attendance at the board. As you know, the board is made up of 28 individuals plus myself as the chair, all senior staff and organisations. So what we find is that generally we have attendance around 70%, but recently we've had issues where either the board or the committee has not been quorate. Secondly, there is a specific issue which was addressed last week by Eilish McDaniel, which is in terms of the thematic review. I raised this issue with Eilish, and essentially I'm quite happy again to answer any questions about that. The issue about the thematic review calls into question conflicts of interest, and that in turn actually talks about some of the independence. So I'll come on to that, Chairman, if I may. So if a review was necessary, is the proposal welcome? On behalf of myself and the board, I would say that we do not favour the proposal. We believe that the proposal is counterintuitive. We believe that for the board to do its work and do its work well, we need to make sure that there's a sustained high attendance by individuals. We believed that there were other ways of actually handling this issue, and we made 3 recommendations in our submission, Chair.
Sorry, can I just clarify for my own point of view here? Are you suggesting that the proposal that's put forward to reduce the quorum from the department, that the Safeguarding Board don't agree with it?
No. Neither I as the Chair nor or the board as a whole agree with it.
And can I ask why this wasn't reflected in the evidence that came from the department last week?
Well, you can't ask me because I don't know. But at the end of the day, it's reflected in the papers, presumably you have, because you will see the submission that I produced on behalf of the board, in which we set out 3 alternatives, Chair.
Okay, yeah, go ahead.
And if you want, I'll very briefly run over those 3 alternatives. The first thing we thought, we do have problems with actually quoracy, as I said. So one of the things that we were asking the department to consider was the possibility of controlled deputisation. We are not allowed to deputise at present, and obviously with very senior staff of organisation that creates its own problems. The members were asking, would it be possible in controlled circumstances to allow deputies? And it was the view that if that was possible, then we should retain the 2/3 quorum rule. In the event that that is not possible, the second proposal that came from the Safeguarding Board was that we would move from 66% to 50%. And specifically in relation to the issue of the thematic review, and I'll come on to that in the next bit, but specifically in relation to that, what we were suggesting was that the rate of, at which the board needed to be quorate would remain as is, but those who were conflicted, who had a conflict of interest, would be reduced from the number of people who were eligible. So therefore, if we have 29, if 9 people had a conflict of interest, then the figure upon which one would judge the quoracy of 2/3 or 50% would be based on 20 and not 29. So they were the sort of proposals that we were bringing forward. We were anxious that a reduction in the, no matter how well intended, that a reduction in the quoracy would actually be a situation where member agencies perhaps felt that they no longer needed to attend as much, and we believed that that wasn't in the interests of the Safeguarding Board or children. So on the first issue, that's our position, and the department are aware of that position.
You had a third? So 1, 2.
Yeah, sorry. The second issue, if I may, is actually the independence of the board, because I know this actually came up in your discussion. And if I may, I would like to take you back to the things that you know about, which essentially is where the Safeguarding Board came from, and it came from Herbert Laming's review of the Victoria Columbier case and Baby Peter. And in both situations, it was his particular view that senior officers of organisations were too distant from the safeguarding issues that were going on within their own organisations. And he believed that one way of making a material difference in protecting children was to essentially create a board where you had senior representation on that board, and that board would be involved in actually together looking at how effectively children were being safeguarded, both within your own organisation and secondly, across organisations. So I think what we do have is we have the right people from the right organisations on the board. But these people are actually bound to, at times, come into conflict in terms of perceived conflict of interests, because they are the leaders of organisations, and others, young people, others may be challenging the practice or the management of those organisations. So inevitably, there's a potential conflict of interest. I think that this committee has to accept that that's actually what you get with the territory. If you actually want people to change and lead change within organisations, you cannot have the independent factor in its entirety, and that's where the whole issue of conflict of interest becomes really very important, particularly perceived conflict of interest and how we collectively work to manage it. And we've been working over the past 9 months to try and manage this potential conflict of interest around the thematic review. The one thing I would say, which I totally agree with, Chair, Eilish McDaniel said last week, the Safeguarding Board as an independent entity is a fallacy. And I agree with that. It is, in my opinion as Chair, it is a fallacy. The only independent elements on the Safeguarding Board are myself as an independent Chair and 3 lay members who basically are appointed up by the Minister. Everyone else on the Safeguarding Board either represents an organisation who is providing services to children or a professional group who have an interest in working with children or families. So that issue about whether in fact we can be independent is really very important in terms of actually the conflict of interest, and important in getting a feel for what the Minister and the Health Committee want or expect. If I may, I'd like to turn to the final point, which is actually just to update you about where we are with the thematic review. And I'm pleased to have the opportunity to do this. The first thing, again, I think Eilish said last time was that I had been with the Minister and had asked the Minister for an extension for 3 months for our work, which the Minister granted. And now our report will come into the public domain in and around Easter of next year, end of March. The first thing I'd like to say about the thematic review is that it is unusual and challenging to actually conduct a review whilst the criminal investigation is ongoing. And that has produced considerable issues for the Safeguarding Board and member agencies and others, including the Public Prosecution Service, as to the way in which we can do this and not undermine, compromise or interfere with the ongoing criminal investigation, because that's the wording in the direction. As chair of the Safeguarding Board, as the independent chair of the Safeguarding Board, I was really very conscious, as I think I told you the last time I was with you in December, of the view that was expressed in this House and at this committee, and indeed in the media, that basically what was being asked to happen here was that the Safeguarding Board, these organisations, were being asked to review their own practice. Now, having been given the direction, I have done what I believe is reasonable to try and ensure that there's a greater transparency and independence to that. And I will remind you that what we've done to date is that we have recruited independent file reviewers, 6 in number whom we've trained. We've actually identified someone from England who is a former police officer, a former social services officer, and actually an academic, to become a quality reference group for this particular piece of work, to actually judge, modify and moderate what we ourselves do. And we have actually worked with Queen's University Belfast to produce an independent thematic report. So the steps in terms of trying to produce independence, that's what we have done. In terms of our work, I think there's one other thing I need to say to you. In terms of our work, there have been 2 drivers, and you would know these. The first driver is that we learned. Is there learning from these 22 cases that would basically say how the system could be improved? So that's an obligation that the Minister and you expect of us. But there is a second obligation that I think not so frequently said, but probably that you also expect of us, and that is the people involved in these 22 are often very vulnerable young people. And their experiences have often created ongoing and current difficulties for them. So one of the things we've had to do as we've approached this piece of work is make sure that we don't cause any of these youngsters any further harm. And that harm, in some situations, could be quite significant. So they are our dual imperatives: learning, but no further harm. What I also need to say to you, 2 things, is that, as I said at the beginning, the direction we got was that we would not undermine, compromise or interfere with the criminal investigation. And our legislation actually meant that we are not able to override the responsibilities set in the Data Protection Act. Now, when I say this, I need to explain a little bit that the Safeguarding Board, although the responsibility of the direction has been given to the Safeguarding Board, obviously the Safeguarding Board is made up of its member agencies. And the responsibilities under the Data Protection Act do not rest with the Safeguarding Board, they rest with the member agencies. Therefore, for example, if a case file was with Trust A or the PSNI, it is the responsibility of Trust A or the PSNI, in terms of their data guardian responsibilities, to look at that case file. It is not the responsibility, nor does the Safeguarding Board have the power in the legislation to do that. So, having said that, we have made, I believe, a very good beginning in actually reviewing the files. We've received cooperation from agencies, very good cooperation. We've begun the process of reviewing these cases. We're currently working our way through them. The process that we've put in place is to review the files for the individual trusts, the files for the police, held by the police, the files held by the Youth Justice Agency, and the files held by Bernardo's. And if the panel want that, the committee want that, I'll explain why. We will thereafter, Chair, proceed to review the files of any other agencies where the information takes us. So, for example, if we come across that there is a particular issue elsewhere, education, for example, probation services, for example, we will pursue that with those organisations. But to try and put some control on what is a very substantial piece of work, that's the way in which we've endeavoured to produce this. Now, I think I want to say one last thing, and that is, I suspect the committee believes that the thematic review will involve the 22 cases. I think I'm saying to you today, and I cannot be precise about what the level of work is, what the number of cases who will be reviewed. That will be part of the ongoing work, but it will not be 22. Firstly, because there will be a group of cases that actually we have not been able to review because of the criminal aspect, because neither the PSNI nor the Public Prosecution Service recommend that we do that, because it may interfere with the ongoing criminal investigation. Secondly, there are a small number of young people whom it is agreed are extraordinarily vulnerable in the middle of this, and where it is suggested that harm may be caused to them in pursuing this. Thirdly, under the Data Protection Act, there are a number of people here who are 18 plus. And those individuals, some of them are at this moment in time not consenting to have their information shared with the inquiry. Now, work continues to try and change them, but the legal advice we have in this matter is that those individuals who are 18 plus have the right to make such a determination under the Data Protection Act. And fourthly, there are some cases of individuals under the age of 18 where member agencies have considered the case and they have the data protection responsibilities and believe that at this moment in time that they are uncomfortable with the information being shared because it would be a breach of their data protection responsibilities. And again, Chairman, the one thing I would want to say to you is that in those last two situations, we in the board, I myself, Sharon, we continue to negotiate and discuss these particular cases with the individuals who are actually either the adults themselves or the organisations who are in a position of making these decisions. So I think that's what I want to say, both by way of the quoracy, the independence, and just where we are with the thematic review.
Okay, thank you, Hugh, for that. And I think, whilst it's not your position to answer this, I think it comes as somewhat of a surprise that the Safeguarding Board are actually opposed to the proposals to reduce the quorum. That's certainly news to this committee, and you know, an issue that we will reflect on and be taken directly up with the department, because I know that when I had questioned last week around alternatives to this, one of them being the fact that the inquiry would assume responsibility for the cases. The initial response was it hadn't been considered, and then secondly it was suggested that that would mean a delay, although that was never really clarified. So I think that's an important piece of information that you've shared with the committee that's certainly news to myself. But specifically in relation to the process, and you know, I'm wondering, Hugh, given that you have said yourself around the criminal aspect of this and the fact that this thematic review will not review the 22 cases, but we've always known that there will be a criminal aspect to this. So my question is, did we get the process wrong?
Well, again, what I know is that from the outset, it was clear that the brief that we were given was we must not compromise, interfere or undermine the criminal investigation. And by any stretch of the imagination, those three verbs are a pretty wide canvas. And for someone like myself who's chairing the board, I'm heavily reliant upon legal advice in these matters to make sure that I don't compromise the Minister or the investigation in this. And the way we've approached this task is to work to achieve a memorandum of understanding with the PSNI and the Public Prosecution Services. And as they make their determination about what is likely in the fullness of time to come before the court, they are determining that those cases they would wish to actually keep from our review at this moment in time. Now, what we have also agreed is that when the processes are complete, we will be in a position to go back and review those individual cases to see what learning there was, probably under the aegis of another power that the Safeguarding Board has, which is around case management reviews.
Well, I suppose my direct question then would be, in your view, you know, you speak a lot there about learning, and you're right. A lot of this and this particular issue is about learning. But would it not have been better or more appropriate to have a single statutory inquiry?
Well, it's an interesting question, and I saw the discussion that occurred at this table last week. I think the thing that I would want to say is, again, I recall the discussion when you met Kathleen Marshall in December. And because we were sitting in the wings waiting to come on behind Kathleen. And I know that it was a discussion and the committee was questioning Kathleen on her powers. Mm-hmm. If the powers that were given to Kathleen Marshall were the same as she enjoys now, this would not have advanced the issues that you're currently discussing, because she would have found herself in precisely the same position, both with regard to A, the criminal investigation, B, the data protection issues. You would have needed to construct this, I believe, and I'm not a lawyer, and therefore it is an opinion that may well carry no foundation, but you would have needed to construct this and the powers in a very different fashion.
Okay, which leads me on to a final question, if that's what you're saying. Again, going back to the point, because when we asked the question around the powers, and in my view remains the position that it should have been a proper full statutory inquiry with all of the powers, we were told that Kathleen Marshall's piece of work could take the powers from the Safeguarding Board.
Can I come in there, Chair? It's not the powers that the Safeguarding Board or the thematic review have. It's the 4 points that Hugh raised earlier, which would still remain if the review had moved to the inquiry. The inquiry would still have to take consideration of the ongoing police investigation and not have any detriment on that process. That would still apply. They would also have the decision on the data sharing and the data control issues would also still remain with the inquiry. And those young people who are maybe now young adults have the right to be actively involved and consent or not consent to that issue. And also we have to consider the potential detriment to those young people if they do become involved, and that is what we have to balance, the learning with the rights to keep those young people safe.
Yeah, but I accept that, Sharon, but I suppose my point is, at what point did we realise that those powers, and it was referred to, and it's reported as such, that it was stated that the powers that were needed for Kathleen Marshall's inquiry could be supported or taken from the Safeguarding Board. So at what point did we realise, even if those powers, as you're quite rightly outlining there under those 4 themes, were going to be an issue even within an inquiry, at what point did we realise that?
Chair, I mean, to be perfectly honest, I'm not even sure I quite understand the question that the powers could be taken from the Safeguarding Board. I mean, obviously the Safeguarding Board has been set up under the Safeguarding Act, and clearly we have certain statutory powers. The inquiry set up in a different way with, I think, powers that would not override the issues that Sharon's referred to.
Yeah, but I do want to go back on this point because it was the rationale that was given, and obviously I don't have the verbatim report in front of me.
Yes.
But when we talked about the need for a full independent inquiry with powers, with statutory powers, it was referred to by the department and by others that the powers that effectively set up the legislation around the Safeguarding Board could be used to support the inquiry going forward.
Those
Well, Chair,
powers,
I don't think we can answer that. I think you would have to address that back to the source. We are actually the Director of Operations and the Chair of the Safeguarding Board. We were actually asked to do this review. We're doing it to the best of our ability. The powers with which another inquiry was set up, I think, for some...
And I accept that there was a directive and a brief that you were given on it, so I'll
and
come
Chair,
back to that.
can I
There's no-
come in on that
Sure,
also?
sure,
I
yeah.
mean, in terms of powers of inquiries, for example, the historical abuse inquiry, the majority of those people are consenting to having their information shared, and that's the issue here, that where consent is not there, you cannot force, if young people are now adults, to provide that information.
Yeah, but again, and sorry, just to clarify
Yes.
on that again, Kathleen Marshall herself, in an evidence session to this committee, indicated that the inquiry would be better placed with more powers. Like she herself said that.
Yes.
But we can come back to that because
As
accept
I
you
say,
can't answer for
we
that.
represent the Safeguarding Board.
Okay. I have Joanne next.
Thank you, Chair. Can I thank you for your briefing and your very frank the way you raised the concerns. I personally would have concerns that the department are viewing this as the best way forward, and in her letter, Eilish MacDonald justifies the need for the reduction of the quorum as being necessary in circumstances where large numbers of members of the board, as we know, have declared an interest. Would this not mean in practice that only certain people on the board would be able to have a view on certain topics? So surely would this split the board into small sort of subgroups essentially? And that depends on the issue being discussed. That's concerning.
Well, can I endeavour to answer that in a slightly wider, put it into context, because I do think the comments I was trying to make about the makeup of the board and its independence are really, really pretty fundamental for this. Again, I repeat, you have people who lead organisations round the table. That's what is the best, that's what's recommended as the best way of actually making progress to protect children. It won't be surprising that from time to time issues will emerge where some of those organisations may well have a conflict of interest. It won't be surprising. The choice is how independent you can make this, and I'm basically saying that the organisation is set up to have independence brought in through myself and 3 lay members. But essentially, we're working together on these issues. Now, in terms of the thematic review and why this issue arose, I foresaw that basically with our, if I say, non-attendance rate of around 25%, right, even if we got most of the board at the meeting, I foresaw that immediately, given the review, that there were likely to be at least 8 organisations who would be the subject of the thematic review. 4 trusts, the PSNI, Bernardo's and Youth Justice. And the work that basically, if there were issues in those files that basically took us in another direction, where we were going to the probation service or we were going to education, then the number of people who might have a conflict of interest could grow, and we would be never able, under the current regulations, to be court. So it was I who approached Eilish and said, Eilish, we have a problem. But I did not believe, and do not believe, that the problem is best solved by reducing the quorum. I think we need to address the issue of conflict of interest. And we've been working over the past 8 or 9 months to try and do that. And the issue of the thematic review, Chairman, one of the things we've done was we've taken a subgroup of the board who clearly have no interest in this, that basically represent the full board through the various stages of the process. We're actually planning about how the report will be received. We're trying to put measures in place the problem we have here is not a one-off problem, but it is a problem that is magnified in the thematic review.
We can go into details if the committee want and how we're handling that process with that small group, but obviously I'll leave that up to yourself if you want to know that.
Okay.
No, I've been busy scribbling down your comments, and it has been very, very alarming. So, in essence, you won't get the opinion of the board, those who do not have a conflict of interest in the topic. This is, you know, everything that you've said raises so many concerns.
Can I come in on that
Yeah, you can go ahead.
one? There are two main areas where the board would be involved with the thematic review, because we have our ongoing processes that are continuing and the board are not involved in, that are the members, where issues are require clarification making on behalf of the board at the various stages. And then secondly is the process for signing and agreeing the report at the end of the process. So what we have set up is this small subgroup who are made up of members of the organisation where there is no conflict of interest, and they're representing the whole sector. For example, we have a non-executive director, we have one of the trust directors who's not involved in the review, representation from voluntary sector and representation from statutory services, and then a professional from a professional grouping. And they meet as required in advance of any thematic review meetings and the board meetings when requested to do so by the thematic review project manager, who herself is independent and has come over from Leeds and was a head of safeguarding services there. And they are really, the group take oversight of the thematic review on behalf of the board. They support with problem solving and they challenge. However, obviously the report will go to the full board members who've been involved in the process for accuracy checking, but also for sign-off. But this is where we are saying about that those who have a conflict will, you know, be removed from the agreement, the final report.
Can I actually, I mean, what Sharon's done there is very succinctly set out the process we're trying to adopt. But there's a more fundamental question for me, and that is the question again, the question of independence and the question of expectation. Because clearly one of the issues that concerns both the politicians and indeed the media is that these processes should be seen to be fair. And one of the greatest conflicts for organisations like the Safeguarding Board in these situations isn't really the actual conflict of interest, because I suspect and believe that almost universally people act and behave in a good and proper means, but it's the perceived conflict of interest. It is the man who drives the bus and basically says, how is it that these boys can be sitting hearing this report when it's actually talking about their organisation? Now, when you actually get into that position, one of the dilemmas I have as the independent chair, and I stress that word, is what am I expected to do here? Am I expected to preside over a situation where essentially there could be such perceived conflicts of interest, or do we try and set up a process which is seen to be independent, and in so doing, and that's what we've tried to do, right or wrong, that's what we've tried to do, and in so doing ensure that those same organisations have an opportunity to actually give their opinion on the factual accuracy of the work, so that we actually get the learning early. But there is an issue here about what is expected in such a review.
Finally, Chair, you spoke of independence, expectation. For me, public confidence is crucial, and you know, the Department have admitted that this is just a quick fix solution to the problem without undermining public confidence in the board. Do you think then reducing the quorum will undermine that public confidence? Because you know,
I honestly would say, in my opinion, I want to stress this, I do not favour the reduction of the quorum. And I'll tell you why, it's nothing to do with public confidence. It is back to the concept that it's counterintuitive. Basically, what we've put together is an inclusive body to work together, warts and all, to try and improve things. To create a situation where people believe that they are less needed to attend because actually there seems to me in the longer term to be counterintuitive. I have no doubt that this wasn't the intention. The intention was to do something to address a particular problem, but I think the solution's the wrong solution.
Thanks, Chair.
Okay, Joanne, Fergal next.
Thank you. Thank you very much, Chair. I don't know if you'd agree, committee, but I think this has moved way beyond the issue of quorum. And for me, it's raising the issue of transparency, accountability, and whether your review can actually deliver at all. And that would be okay if we were having this discussion now, not against the backdrop of us raising these issues around the powers that Kathleen Marshall would have, or any other inquiry, because I don't think we limited our comments to what Kathleen Marshall's comments were. There was discussion about a robust public inquiry with statutory powers. Now, you've highlighted 4 issues here which are limiting your ability to get access to everything. Would a full public inquiry with statutory powers allow you to, or allow that organisation to get further access to the truth, or at least the information, if it had been set up in the first place? A full public inquiry.
I honestly do not know the powers. That would be a legal question. What I do know, and can only repeat again, is what I've said. We cannot go into the criminal cases. There are issues around data protection. Some of these individuals are 18 plus, and other individuals is commonly and universally agreed are very vulnerable. Their mental health is vulnerable.
But you've also married the fact that, in fact, what your process is the organisation involved reviewing their own processes, not interrogating their own processes, not trying to get at the truth in that sense, not trying to get at responsibility or culpability, but a mere review of their processes. Marry that against those 4 things that you've highlighted, and can you produce any kind of report at all?
Well, I believe we can, to be honest. And can I just come back on the point that you made about our particular process? I think one of the things that has been a complicating factor here, Mr. McKinney, and I actually was in contact with Rotherham Social Services, given their review, coming here to you today to try and understand the context. And again, it actually emanates from trying to be independent and transparent and the work that was being given to us. From the outset, what we wanted to do, what we as a board wanted to do, not I as the chair, what we wanted to do was be able to show that this was a process in which the public could have confidence. And one measure of doing that was to actually seek access to the files, that we had independent people reviewing the files. So that was meant to illustrate to you and colleagues that basically we were serious about transparency and independence. The corollary of that is that once you do that, you actually introduce other issues around data protection. So in Rotherham, what Rotherham did was Rotherham brought in some individual, Alexis J, and she came in and she reviewed the files on behalf of the council. She came in and reviewed the files. Now the issue for her is that she then had access to the files, but she would have had problems if she was reporting to a third party. The Data Protection Act and all its implications would have come into play. Now, I have no idea about inquiries, public inquiries, and the powers that they would need to have to overcome those. I think you're asking the wrong person.
Can I also say that any public inquiry could not have a detrimental impact on any police investigation?
Yes.
The police investigation, and it's extremely important that that is allowed to continue, that any potential perpetrators are brought before the courts. So any process could not interfere with that ongoing police investigation.
Yes, but what you're spelling out is the ability for either an inquiry or your review to be flawed because of the extent to which you can or cannot get access to information. So we expected some time ago an inquiry into 22 cases, and you're telling us today an undefined number,
Yes.
but I suspect significantly less than those 22 cases.
I'm saying, that's right, it will be less than the
Yes.
22.
And you're saying, and with a combination of all of those
Those
things
factors.
coming into play, the review of their own cases,
Yes.
the vulnerable, the criminal investigation, data protection, and over 18s not wanting to participate, you're saying that you're trying to morph your processes to cover perception, right? And you've said, right or wrong, that's what we're trying to do. Haven't you introduced in that very statement a perception in the public mind that your inquiry will not deliver to the full extent that it could do?
Well, it will deliver to the full extent it can do.
That's a
within the confines of the current law.
That's exactly, and that's my point. And isn't that flawed?
Well, it's all that we can do.
That's not what the public want. The public need a reassurance that there's a robust inquiry in these 22 cases and that we get answers about what happened in these 22 cases, not an apology.
Mr. McKinney, sorry, can I come in? The SPNI still have its other powers in relation to the case management review function. That means that all of those 22 files can be referred to the Safeguarding Board and they can review those individually in relation to that. And we do have agreement with the police and the PPS currently through a memorandum of understanding through the case management review function that we can undertake case management reviews.
But you're not doing it as part of this review.
We can, that process can be done. The reporting will not come out at the same time, but the power to do that is still there, and it will be part of the normal process. So all of those
Yes.
files can be done through another process, or in conjunction with another
Although
process.
that's not what I'm hearing is happening, given the extensive evidence that you brought forward. And Chair, just one final point. All of this colours. What was the board doing by trying to introduce a third quorum? When the board, this board,
The department?
the department, sorry, apologies. What was the department doing by trying to introduce a third quorum in this matter? Was it trying to slip out a report?
Well,
Well, I understand the situation that
I
the
didn't ask
folks are in
the
here,
question.
yes.
no.
But I do take that, and I think, yes, I think that's one of the issues that we need to
Sure.
reflect on and go back on.
May I have one word,
Sure, yeah.
please, about what your final point? I will assure you that we will conduct the review as robustly, as thoroughly as we can, within the confines of the cases that we can review.
Absolutely. And I share with you your worries, if you like, and your concern about the limitations
Yes.
within which you're operating. But that's not.
Yes.
When we quizzed about this issue in December, and when all of this was set up, that's not what we thought we were getting. And now we're hearing that there's significant constraints on this review, and I'm not convinced, for one, as a result of what you're saying, that the public will have confidence in the results of this report.
Chair, can I come in on that one? At that stage, it was unknown of how many cases would be involved in the ongoing police investigation, and no
I
matter
accept.
what review or public inquiry, they still would not be able to review police files where there is an ongoing police investigation.
I accept that, but these were all issues that were raised at the time, and it was insisted upon that it be within your confines. We recommended another approach, or at least members
Yeah,
of this
absolutely,
committee.
absolutely. Okay, I know Roy had, Fergal, you finished there?
Thank
Yeah.
you, Chair.
Roy?
Thank you.
My understanding of this process is to try and gain early lessons
Yes,
across the various boards so that others will not suffer.
correct.
And I have to admit, I have concerns if there are ongoing delays, and some public inquiries can take years, some even decades, before they report. So that's something we have to bear in mind and have cognizance of. I want to just clarify, in reviewing the files, this is very, very important. Who actually reviews the files? How are they determined to be independent?
We have recruited and trained a group of individuals who have no connection with these cases or these organisations to review the files of the 4 agencies we've previously mentioned. So they are independent file reviewers. The second thing we've also done is that we've linked them in to Queen's University Belfast in order to try and ensure a consistent message, a consistent learning message, an early message, so that we have a standardised template which gathers the data together, which can actually then be looked at to be analysed. So the people who are doing this piece of work are actually independent of the organisations. They're reviewing the files.
And they're also quality assured by the 3 external quality assurers that the Chair, the Hugh, mentioned at the very beginning.
And they are all
Independent.
Yes.
The 3 quality assurers are in a similar reputation as Kathleen Marshall. We've brought them over. They're justice background, social services background and academia in the area of child sexual exploitation.
So who actually then writes what will be the first draft of the final report?
The report author in that regard will be Professor John Pinkerton from Queen's University Belfast, and he will produce the first report.
And has he any conflicts of interest in all of this?
No.
Okay. So with independent assessment of those files which access can be gained to
Correct.
under the law, respecting the criminal justice system,
Yes.
respecting Data Protection Act.
Yes.
Okay.
Maybe that was rhetorical.
I would like the ideal situation just as everybody
Yes.
else would, but I'm trying to ascertain how it would be achieved. It may not be achievable, but I want to get lessons learned so others don't suffer. Your idea of controlled deputisation, what exactly, how would you, what's this controlled? I know what
Yes,
deputy is,
no,
but
no.
so how would you control it? Because it's
Well-
important that lessons are learned high up in each organisation.
Well, for us, in simple terms, we have 29 members. And to be on the safeguarding board, you have to be number 1 or 2 in your respective organisation. So actually, we have chief executives and directors. Essentially, very senior people who are able to make decisions, able to influence policy, but also whose time is at a premium. What is being asked or suggested was that the department would consider a named deputy attending on behalf of those individuals in a certain number of cases, a certain number of meetings per year, with the consent of the chair. Now, that controlled deputisation would probably help us achieve the continuing 66%, because we are experiencing difficulties of actually being able always to be forward.
Also, for example, the suggestion would be that actually deputisation could be up, not just down.
Yes.
So a named individual actually could be a higher in rank,
Yes, that's
which
right.
is a suggestion that the police have put
Amazing.
forward to the SBNI.
Okay. And what feedback did you get from the department when you suggested these methods of enabling you to operate with effective numbers of key people?
Well, I think actually everything just became caught up in this particular process of actually coming back, the regulations change and coming back to the Health Committee. So we have not further discussed it, whilst obviously this ongoing debate with the committee is taking place.
We did get advice that, and I think they presented that last week, that they'd looked at all other options, but their legal advice suggested that they couldn't be taken forward. The board members, we put a number of options forward, and in terms of getting a formal response to that, our suggestions, whether it could work, that hasn't come back to us.
Just going over your 3 suggestions of controlled deputisation, the reduction of the quorum from 66% to 50%, and then this idea of the quorum would reflect those that could attend.
With conflict of interests.
Yeah.
So it would only in the situation was a conflict of interest.
Yeah.
So in every other situation, we believe that the quoracy should be at a high level, 66 or 50%. In a situation, we still believe it should be at that particular level, but where you have a conflict of interest, what the suggestion is that those who are conflicted, are their numbers are taken away from and the new figures used.
Mr. Beggs, that's not unusual. That is we are hosted by the Public Health Agency, and that is a procedure that they follow. So we were mirroring what other public bodies do in situations of conflict.
Why would you reduce the quorum less than 66% if you built in the other two measures? Because I think it is important that there is a high level of attendance at a senior level so that learning and experience can occur. So why would you need that third item if there was the flexibility in the other two?
Because quite simply, if you, and it's a hypothesis that you would need to agree with, but my particular view of this matter, and I drew this to the attention of the department, I could see the meeting with the normal people who were sick or on holidays or whatever, and then basically a conflict of interest and people saying, I really should not be present at this discussion, meaning that we were going to be below the 66% and therefore struggling to actually fulfil our responsibilities. And I thought that issue needed to be thought about earlier in the process.
That option would not, if legally we can do the other two options that are presented. It is our preference to remain at the 66% if the other two options can be worked through.
Right, okay.
Yeah.
Yes, that's our preference.
Understand. Thank you. And can I just say, the ideal situation does not exist. We have to come to a mechanism that allows learning to occur and a report to be made. I personally would favour a report to be made at some point, and which is not that far away if you look at it in terms of time. And at that point, if there is dissatisfaction, maybe that's the time to go for a public inquiry.
Do you want to comment on that?
We can't really answer
Okay.
on behalf of the department
Okay.
in relation to public inquiries.
Thank you, Roy. I have Gordon.
Thanks, Chair, and thanks very much, folks. Are you satisfied, Hugh, that the makeup of the membership is of a good standard?
Absolutely.
You are?
100%.
Yeah. And do you feel that those are the sort of people you need on that board to carry out an effective and efficient job?
I absolutely do, Mr. Dunn. I think the real question, and the reason why I do, is because I believe what we are set up to do is to bring those who organise the services together to have discussions about how the services can be improved together.
Yeah.
I don't think we're not an inspectorial body. There are other inspectors. We are not. I'm at pains to actually try and say here about independence, because when I took up this post, there was a general view about that somehow or another the board was independent. The board's not independent. But in terms of the people who are responsible to do the job, I believe we have the people, the right calibre from the right organisation.
No, they're because of their professional competence.
Absolutely.
And obviously, going back to Lord Lamy's recommendations in Victoria Climbia and Baby Peter cases, they believed that senior staff within organisations were too distant from the experiences of frontline staff, and said that improvements could only be made if safeguarding boards were populated by senior staff in order to drive through those improvements.
The people with the executive responsibility then at the top.
Yes.
Yeah. Just a couple of other issues. Yes, how do you... The conflict of interest, is that assessed by yourselves prior to the sitting of the board, or is it left to the individual to declare the conflict?
Well, what we have done in relation to the thematic review is take legal opinion, and that legal opinion has been shared with the board. The expectation is that every member of the board will, at the time, actually make their own determination whether there is a conflict of interest. One of the things I've tried to emphasise is that the conflict of interest isn't just actual, it's also perceived. And it will be up to each individual member to make their determination at that stage.
So on the day, when they come into the meeting, for example, are they aware of the cases that are being looked at prior to coming to the meeting? Or are they going to have to make that assessment on the day?
What our intention was as the report is written, then all of the organisations who have contributed to the review and whose work has been reviewed will obviously have the opportunity to see the report at an early stage. They will have the opportunity to do that, as with any report, to actually say, factual accuracy check, is this right? Did you hear this right? Essentially, thereafter, any modifications that they would make would go back to the report authors, who would then consider the changes, if necessary, or if needed, or if appropriate. And then the final report would come to the board. And at that particular time, all of the board would know, at this stage, we have been through a process, and the report is here for the board to consider it, consider the recommendations, before obviously bringing to the attention of the minister who commissioned it.
We have two options that will be considered at the board for the handling of the report, and it's around the conflict, and it's looking at is conflict involved in any agency who may have provided a service to the young people, or is it those agencies who were directly involved just with those young people? And once that is decided, there will be guidance developed in terms of how the report is then handled at the board, but going through the process that the chair has already mentioned.
Okay. Just finally, the Quality Assurance Group, how do they carry out their work? Is it just a paperwork exercise, looking at all the documentation? Are they looking at all the processes, or are they going to be actively involved?
It is, I think, in the majority, reviewing documentations. It is also actually being involved in the process before the documentation. So essentially, I mean, and again, if I can remind you of who the people are, because it has probably slipped your mind. I mean, we actually have Professor Jenny Pearce from the University of Buckinghamshire, who are the country's leading academic institution on child sexual exploitation. We have Peter Davies, who's currently back with the Norfolk Police Force, but was previously the Chief Executive of the CEOP, the Child Exploitation Online Protection Unit. And we have Marion Davies, who's a former, actually, Director of Social Services in Warwickshire, and who was involved in the Eileen Munro review. So what we sought to do was actually to bring people here with credibility. And the one thing we have asked of them, and the one thing that's recorded, is that we're basically saying to them, we want you to tell us, to challenge us, that this is being done properly and independently.
And we also brought Queens in from an academic and a local perspective to ensure consistency in the file reviewers, consistency in the way they gather the information, and consistency in the way that is assimilated and put together.
Okay, so you've got fair assurance there that
We believe
you're
so.
sticking to processes and procedures?
Yes, and they've helped in the construction of those processes. They monitor those processes. They get the results of what's happening, and if there are special issues that crop up, then basically they have their input into that as we try to resolve them.
And basically, they bring those issues, if they have any issues, to the project manager, who I mentioned before was head of safeguarding within Leeds, had a responsibility there within the Leeds Safeguarding Board. And if the project manager has any concerns, they bring them to my attention, and I'm independent as well of those organisations involved in the process. So we've put as much assurance in as we possibly can within the direction we've been given.
Okay, thanks very much. Thanks, Chair.
Okay, Gordon Mickey is next.
Yeah, thanks for the presentation. I suppose it follows on from what Gordon was saying. There's 29 people on the board, and obviously
Yes.
you're the chair and independence, you've stated. Those people are there because of their expertise. They're all
Absolutely.
top of their job. So essentially, if you take away 2/3 of them, you're taking away 2/3 of that expertise. So I suppose it really hinges on the degree of the conflict of interest. And I presume that would be looked at. But I asked a question last week that the Children's Law Centre has put forward material which seems to me is quite sensible.
Yes.
And I asked Eilish McDaniel that I felt that their views had not been addressed, and I didn't get an answer to that question really. It was kind of spoke about something else. But they are unhappy, for instance, about the EQAA and issues around that in
Yes.
terms of the consultation and that. So I'm just wondering, do you feel that they have legitimate views which should be addressed in all of this? Because ultimately, what the department are saying is that 2/3 of the membership could be taken away in certain cases. And I do accept the technicalities around the data protection and ongoing legal sub judice and all of that.
Yes.
But it just seems to me that you set up something, and I said it last week and I'll say it again. Jim and I were in the committee in the last mandate that was dealing with all this, and I was on the impression that the Safeguarding Board was set up to actually do the best possible job for the protection of children and vulnerable, very vulnerable children in that. And it just seems to me that these problems are problems that could have been foreseen because of the nature of the make-up of the Safeguarding Board, that you have people who are going to be dealing almost on a daily basis with these type of cases.
Well, I think that's the very point that I'm trying to make. And I think fundamental to this is the determination that having people at the top of their game, the top of the organisations, people who have the capacity to lead and change and direct, if you get that, what you also get at the other side of the coin is people who have a responsibility for practice or managerial decisions, and you cannot divorce the two. So when you actually go and say, as Herbert Laming has said, that the best way to protect children is to have that group of people around the table, then I think everyone has to recognise that there's a corollary to that, and that is that from time to time there will be conflicts of interest, and the real issue is how best we manage them. The other thing you said about actually the Children's Law Centre, the Children's Law Centre are a member of our board. The Children's Law Centre's views are incorporated in the submission that we have made to the department.
Basically, the Children's Law Centre did not agree to reducing the quoracy to the third for the very reasons we have just highlighted today to yourselves. Also, I know the Children's Law Centre are, mentioned about the equality information, and we can't answer again on behalf of the department. But they also raised the issue of the independence and potentially the move to the inquiry. All we will say is the inquiry will face the same 4 issues that we have, and the inquiry is set up in no different. In fact, we have more legal powers associated with us to carry out our case management review function, and they will still have the issues of the ongoing police investigation, the detriment to those young people. But we also must consider those young people who have agreed to talk to us and their rights to have their opinion heard, and the work that we have done with those young people to bring them to that stage to be able to trust and communicate with the independent chairs that we have and with the wider group.
Well, thanks, and take the point, but we just finished by saying, it goes back to your point, you have all these experts sitting around the table and you're going to lose 2/3 of them. And presumably you could, in worst case scenario, have more than 2/3 have a conflict of interest. What do you do then?
Well, we could have, but I don't think we will have, to be honest.
No, well, interesting enough, because Eilish McDaniel said last week it wasn't an issue on a day-to-day basis. My point was it could be an issue.
It could be.
But Mr. Gray, we have an alternative proposal put
Yes.
forward that we could deal with that
I think-
if the need arose.
Just to build on, what I said in our submission was that I thought that the issue of quoracy was actually not the central issue about how the board, which is a fledgling board, only up a couple of years,
I understand.
how the board will ultimately try and resolve issues of conflict of interest. That's the more fundamental issue, to try and create a standard in the board, a way of working. That's what needs to happen. Time needs to be given to allow it to happen. I think what I definitely want to say is that we, the board, are approaching this issue as seriously as we can within the confines of the law. We will produce, for this Assembly and for the general public, a thorough piece of work on the cases that we are able to investigate, but we are not able to investigate them all because of powers out with the board's control.
Well, I'll just go back to the point again. It's the degree of conflict of interest and how that might impact or impinge on a particular case. So, you know, obviously there may be a very slight conflict of interest, which may not necessarily adversely impact on any decision, because you assume that these people are professionals, which they are, and that they're not going to let something actually impact adversely on the cases that they're dealing with.
You see, one of the problems that I have, in all honesty, is trying to set a standard for this, truthfully. And, I mean, I totally agree with you. And yet, you and I know that someone somewhere else may turn around and say, well, look, this just isn't right. Basically, these people, why are they on the board if they're not leaders of the organisations? How can it be defined that they wouldn't have a conflict of interest? And certainly some users and carers and victims and people who have suffered basically would take that particular view, and I accept that totally. I accept that totally. All I'm saying is that what we're trying to do as a board, in the light of a very, very difficult and high-profile issue, is find a way for a very complicated situation. It's really important that we don't throw the baby out with the bathwater, because the problems are the same problems. It doesn't matter who has them. We've got to work our way through this.
Chair, can I come in with one last thing? It was raised about how the board is effective. I mean, the board has a wider remit than the thematic review, and we always, from our inception, child sexual exploitation was a priority for us. We are working really well and effectively as a board in bringing forward lots of support and changes in how that is dealt with those agencies. I mean, for example, in the recent campaign that we did, we have had something like over 10,000 hits to our site to get information, where we've worked with Bernardo's in developing scenarios of how to get help and how to recognise the signs of CSE. And I don't know if you saw the billboards that have been out in the Safer to Know campaign. We've been working with the taxi drivers and the wider community in order to do that. So.
And we're launching in October, November, a community-based campaign across the 5 trust areas, working with local people to identify, to try and raise awareness, not just about taxi companies, not just about licensed premises, but about party houses and the concerns that might be going on and how you handle that. So we're doing lots of things more than the thematic review, and I think it's really important that you understand that and you put that in due consideration.
I think, with respect, we know that and we accept that and we appreciate that work, but that we're not discussing that work at this stage. I think Pam had indicated there.
Thank you, Chair, and thank you very much. It's been a very, very interesting evidence session today for us. You'd mentioned some people by name there. Was that the independent lay persons you were naming?
No, it wasn't.
That wasn't?
The 3 people I mentioned by name were actually the 3 external quality assurers who we've brought in to support John Pinkerton in terms of producing the report.
Okay. And obviously, the Department mentioned last week that other safeguarding boards operate with the proposed quorum of a third.
Yes.
There obviously aren't any easy answers to this. It's a very complex matter, as you've well laid out. But do you know, or are you aware from the other safeguarding boards of any other type of potential solution to the problem?
No, I honestly think it's a bit of perspiration and a bit of sticking with the process. If you have the very top of organisations at the table and they're able to do all the positive things in our society, where there is the culture of actually sort of looking at responsibility, accountability, then you also have the prospect that these issues will be addressed and these same individuals will actually have to big account for their organisation's performance. So I don't think it's an easy way around this. What I do think is that you have the right people from the right organisations. And I would say to you, the board is 29 members strong. It's a big board, a big board. I think it's really important that we make sure that we give the board the opportunity, the time to bed down and actually do work. And I would be really, again, wanting to make sure that the committee heard that I do believe that the conflict of interest is something that will happen. We will work our way through. We'll find a way around it. I would not support, and the board does not require a request, that the core C numbers should be reduced to a third.
There are other safeguarding boards who operate with the third as highlighted in the department's evidence, but there are other boards that operate in a similar way to the proposals that we put forward. But I just also wanted to highlight that the safeguarding boards in England have a very, very different structure than here, where they have executive groups that make decisions and that goes up to the board. We are trying to mirror that in the small group we have set up in relation to the thematic review to bring that decision making and overcome the conflict of interest. But they have, as I say, they're very different. They're under local authority, and we're completely independent of that setup, which is why we were not set up under the Health and Social Care Board here.
Okay, and given that all of the safeguarding boards will have the same or very similar issues, is there no method of cooperation because of the different systems that could be used, that you could potentially, share
Absolutely.
people?
They're set up under different legislation than ourselves, but in terms of working with those agencies or those safeguarding boards, we very much work with our colleagues. However, the reason, going back to Hugh's point, the reason why the members are there is because of their expertise in safeguarding in the Northern Ireland organisations that deliver the services.
The Safeguarding Board is obviously a statutory organisation set up. If you go to the local safeguarding boards in England, they are not on a statutory basis. They must be on some form of secondary legislation basis. It's a policy requirement arising from Herbert Laming, and that has some fairly significant implications in terms of the differences.
Okay, thank you.
Okay, just one final question. When the thematic review was being set up or being proposed, did the board consider that it was anyway, what you were being asked to do was anyway ultra-virus?
Was anyway?
Ultra-virus?
Yes.
You did?
Yes, we did. I mean, early in the process, Chairman, and the question was raised about whether, in fact, the direction was ultra-virus. We, at that stage, took advice.
Legal advice?
Legal advice. We got a QC. The advice of the QC was that it was not ultra-virus. Actually, that advice was shared with all of the members of the board, and on the basis of that, the department then issued their final direction to us. And that direction actually came to us in December of last year.
Okay, well, thank you for clearing that up. And thank you for attending. It has certainly been, I suppose, eye-opening to hear from your own point of view around, first of all, the fact that you didn't agree with the proposals in terms of the reduction of the quorum, and I think importantly that you actually put forward a number of options. But I think this debate has moved on to more fundamental issues which are outside of your remit at the present time, and I think there are very serious questions in going forward in relation to directly to the department around the need for the thematic review, and I think some members have raised as well what effectively the department were doing in terms of coming up with a proposal for reduction, and I accept that you can't answer that. So I want to thank you for your time, and we'll certainly be reflecting on the evidence that you've given us today.
May I make one final personal comment?
Sure.
It would be remiss of me to actually not raise this with the committee today. On a personal basis, I handed my resignation to the Minister on the 1st of September. I'm going to retire. and I'm retiring for personal reasons, including a recent health scare that I've had.
Is it 1st of October, 1st September's passed?
No, sorry, I handed in my notice to the Minister of Retirement on the 1st of September, but retiring on the 30th of November.
Okay.
On the 30th of November. And I just wanted to say to you, it's not any way related to the work. It is for personal reasons, including a personal health scare that I've had in the recent weeks.
Okay, well, I thank you for sharing that with us, and Hugh, I want to wish you every success in the future.
Yes, thank you very much.
Thank you very much.
Thank you. Thank you.
Okay, members, in terms of next steps, I mean, obviously we had been requested to agree the proposals for the statutory rule, which I think the position from last week still stands around concerns around that proposal, but I think there's more fundamental issues at stake here now, and I really do think that it's quite alarming when this was flagged up at the start of this process, the importance to get this process right in terms of protecting children and young people who are so vulnerable. And this isn't something new. In essence, most of us reflected on the need for a proper, independent inquiry with statutory powers. And I think there are fundamental questions that the department have to answer here in regard to the need for that thematic review or the outcomes now from both those processes. I would suggest, members, what we do is we ask the department to reflect on the last 2 weeks of evidence that we've heard and to respond to that and come in front of the committee and respond to that. Because I really do think it's quite alarming, and I think particularly when we look at the situation, the horrific situation in England, when we listen to like a multiplicity of agencies involved in this process and how there is almost consensus on failure right across the system. And I think it also, members, will be important to reflect that we do have the opportunity with the Professor Alexis Jay, who is going to be here in the next number of weeks, and I think it would be very interesting to hear directly from her about the issues around conflicts of interest, ultra vires, being outside process, and how you overcome these 4 issues that the Safeguarding Board have identified. I mean, these aren't issues that would be new to people. So what would have been the correct process to put in place, the appropriate, accountable process that would actually achieve the results? And I think it's of concern what we've heard today. So I'm seeking agreement, members, that we write to the department, ask the department to reflect on the last 2 weeks and ask them to come here with a degree of urgency to outline their response to what we've heard. Farrell, you had indicated there.
I mean, I think it's our job to, obviously to scrutinise. We need to ensure that those at the centre of this, in terms of the 22, are protected. Most importantly, that others who are potentially at risk are protected. I think it's our job to protect the Safeguarding Board as well, without overstating things. And, I just reminded myself of some of the Hansard of December, and there was a fairly reasonably robust exchange, if my memory wasn't wrong, about the robust exchange that was had with the department. And, at that stage, it was identified that there was no statutory powers. It was described as a ministerial decision, but however they said that they'll set the questions and we'll give them the answers. And yet the Safeguarding Board's describing today how in fact it's not getting the answers. And Kathleen Marshall said in defence of the proposed system that it wouldn't be hindered, or it would be hindered by criminal investigation if we were proposing a public inquiry. Yet we're hearing what was replacing it is now being hindered by criminal investigation, as well as a wealth of other issues. And I think it's important to remember too that at that initial session we were asking why the Bernardo's report hadn't been implemented, and it had come up with recommendations which could have prevented the 22 cases. And we were told we were asking who will ask the tough questions, and of course they were avoiding the tools for asking the tough questions because there was no statutory inquiry powers, and they came up with a Kathleen Marshall version linked to a Safeguarding Board version. And I think the evidence there today suggests that there's constraint at least on the system. And I am deeply worried about why the department came then against that backdrop and requested a drop in the quorum when the Safeguarding Board rejected that proposal itself.
Okay, Fergal, thank you. Yes, Roy?
Another thing which I think we all have to build into our thoughts is there's an indication there that some young people have their confidence has been gained. They have opened up and given them their experience so others can benefit.
Members.
And we're halfway through that process with them, so we need to be very careful that their confidence is not lost and that their evidence is not lost in this process by jumping halfway through. So that's something that has to be in our minds as well.
Absolutely. Okay. Seeking agreement to go back to the department on that. Okay, members, moving on is item 7, which is the provision of health service to persons not ordinarily resident. The regulations. I'm referring members to page 126, which is on the meeting folder, and to page 15 of the tabled papers. I want to just remind members again that in December 2013, the committee had considered the provision of health services to persons not ordinarily resident regulations, and we were not content with the proposals on 2 fronts. We were of the view that free secondary health care services should be provided for all failed asylum seekers and not just those who were on the Home Office schemes. And we were also of the view that free primary health care should be provided to all failed asylum seekers. So that was both secondary and primary. So following the consideration, the committee did write to the department and asked for a commitment to examine the issues further and to engage with the relevant stakeholders. The department had responded to the committee in January, indicating that it would consult with the Law Centre and indeed other key stakeholders. I want to advise members that the department has submitted revised proposals now for consideration. So I want to welcome Stephen Galloway today and Robert Kirkwood. You're both very welcome. Just reminding yourselves as officials that the SL1 letter should provide obviously sufficient information for the committee to carry out our role in terms of informed policy scrutiny, and should explain in layperson's terms the purpose, background and implications of the proposed legislation, and indeed a summary of the outcome of any consultation which has taken place. We would view this, obviously, as any committee would, as especially important, but in this instance, because it's a revised SL1 and it's been presented following concerns raised by the committee, we need to be absolutely certain whether the concerns and those of the relevant stakeholders, as had been highlighted earlier, have or have not been addressed. And I think it is suffice to say that we're disappointed that the SL1 letter which you sent us didn't detail the engagement you've had with any key stakeholders since the January 2014 letter. Didn't indicate any of that on any of the issues, or whether indeed, and I think this is important for the committee to know, whether the key stakeholders were actually content with the revised proposals. We accept that you have now provided information at the committee's request in the form of a supplementary paper, and thank you for that. That is welcome, but we would have expected to receive all the relevant information last week. And I would suggest that the committee would expect that in going forward. So I'm going to ask the officials at this point to brief the committee, obviously, on the revised proposals, and then I'll open it up to questions from members.
Okay.
Thank you.
Thank you, Chair, for allowing us the opportunity to present to you today the draft regulations on overseas visitors and their access to healthcare in Northern Ireland. By way of background, it may be useful just to set out briefly the history. You may have run over some of it earlier in your opening comments. The background and the history to the regulations. So there was, following a review of policies and legislation governing visitors' access to healthcare, the Department conducted a consultation on new policy proposals, which broadly brought us into line with the rest of the UK. And during that consultation, there were 37 responses were received, which were positive and welcomed the moves being made to update and clarify issues within the legislation. The majority of the proposals were either technical or for clarification purposes. Now, that consultation ended in April 2013, and the Department decided to introduce the provisions in line with the EU directive legislation at the end of 2013. However, whilst committee members agreed to the proposed amendments in relation to the persons not already resident regulations, it recommended that the Department review 2 specific proposals. The first proposal was in relation to asylum seekers, and the second was in relation to the extension of the present exemption of charges categories for secondary care treatment into primary care. So the Department agreed to undertake further consultation with key stakeholders and examine further these two specific proposals. In relation to asylum seekers, currently the Persons Not Ordinary Resident regulations, secondary care services are available to an asylum seeker with an application pending. There is no provision for failed asylum seekers other than emergency or urgent health care, which includes emergency services at an A&E department, emergency care in a GP practice, including maternity services, sexual health services, or treatment for some infectious diseases. The draft regulations which we brought to the committee last year introduced a specific exemption from secondary healthcare charges similar to England for failed asylum seekers who receive Section 4 or Section 95 support and who are cooperating with UKVA. When considering whether to extend the regulations to include the small number of those who have sought asylum and been refused to the extent that all appeal rights have been exhausted, the Department consulted with the Departmental Solicitor's Office, the UK Border Agency, the Business Services Organisation, colleagues in the Department of Health in England, Wales and Scotland, and with the Northern Ireland Law Centre. Taking into account the Committee's recommendation in relation to failed asylum seekers and having had time to consider the position in the rest of the UK and the arguments put forward by the Law Centre, the Department proposes extending the entitlement to healthcare for all asylum seekers who have sought asylum up until the point when they have been served their deportation papers. This policy change has been discussed and agreed with the Northern Ireland Law Centre, and the Department has also agreed to engage with the Law Centre when drafting the guidance to accompany the Persons Not Ordinary regulations. In relation to primary care and extending the exemptions, the Department had originally proposed last year that it considered it prudent to give this proposal a bit more in-depth thought and look at its ramifications before implementing it. The committee, however, had recommended that we undertake some further analysis on that issue. So, following the committee's recommendation, the Department discussed the issue in detail with the Departmental Solicitor's Office, specifically around Article 42 of the 72 Order, which deals with the ordinarily resident principle, as once a person has ordinary residence in Northern Ireland, they become entitled to free health services. So, although everyone is currently entitled to emergency treatment in a primary care setting during a visit to Northern Ireland, having now had time to fully examine the issue and take account of the primary aim to ensure that everyone is treated in the right setting at the right time, the Department now considers that the Persons Not Ordinary Resident Regulations 2014 should be extended to cover primary care services for all categories of visitors exempt from secondary care services, apart from visitors who are entitled to these services under EU regulations or EU legislation. Therefore, after further consideration and taking account of the views of the Committee and the relevant stakeholders, the Department proposes that the Persons Not Ordinary Resident Regulations 2014 should be drafted to include those who have sought asylum and who will now fall within the scope of the proposed draft regulations and therefore be entitled to access free healthcare and primary care services for all categories of visitors exempt from secondary care services, apart from visitors who are entitled to services under EU legislation. The exempt categories will be entitled to register with a GP practice during a visit, entitling them to the same provision of services a resident in Northern Ireland be entitled to access. So hopefully, while taking account of your comments earlier in terms of the SL1 letter, hopefully the committee members can see that we've taken on board the comments and the views of the committee and we've amended the regulations accordingly, and that the committee would hopefully be in a position to agree them as now drafted. However, we're happy to take any questions and answer any queries that the committee members may have in terms of the regulations.
Okay, thank you, Stephen, for that. Just in relation to the failed asylum seekers' access to the secondary care issue, the free secondary care.
Yes.
What you're now proposing, just so that I'm clear, is that people should be able to access that up to the point where they've been served deportation papers.
Yes.
So, how long is that period generally? I mean, what's the time scale between someone actually being served deportation papers and actually leaving?
The regulations will be drafted in such a way that it will provide both primary care now and secondary care for an asylum seeker who has made an application. And that's all the regulations will say. It has been agreed that the provision for primary care and secondary care will be provided up until deportation papers have been presented to the person. As you say, that can vary in the length of time the deportation papers being presented and the time that the person would actually leave the country. The provisions there will be set out in guidance to accompany the.
But sorry, does the department not know that? I mean, would the department not know?
It differs in individual cases. So they agree what in discussion with the Northern Ireland Law Centre, it was agreed that there would be further work taken forward, and that that aspect would be set down in guidance. What it'll mean is that basically that no failed asylum seeker, once they get their deportation papers, it doesn't mean that their entitlement to free primary and secondary care will stop automatically. It'll be set out in guidance that until the person actually sort of is in a position to leave the country.
But why then are we saying in this that you'd be able to access that care up until the point when you've been served deportation paper? That seems very different.
That issue will be fully covered in guidance in consultation with the Northern Ireland Law Centre.
But I think, I mean, I'm not clear on this, and I think we need to be absolutely clear on this. It needs to be large and clear within the regulations, as opposed to, I mean, very specifically, and Stephen, in your opening remarks, you said specifically free access until a person has been served. And we're saying there is a considerable, or there may be a considerable period of time, which has implications in terms of access to healthcare and obviously also cost, I would imagine.
Mm-hmm. Well, it's one of the, in terms of Robert quite rightly saying, the regulations won't state that in terms of a specific phrase of that they, up until the point where they're served their deportation papers. The guidance that follows and supports the regulations will make it very clear in one instance. Again, that has been the agreement, discussion with the Northern Ireland Law Centre, and they are content.
Well, then, maybe I'll try this a different way. Why could it not be stipulated in the regulations then?
Legal.
If you're saying this is not about the time where the papers are served, it's about the period where the person, at the point where the person leaves, surely that should be stipulated in the regulations.
Our legislation was drafted in, it was drafted in accordance with the Welsh legislation, and I mean, basically the easiest, I mean, rather than being stipulating specifics within the legislation, it is, because of the differences that can arise with these category of people, it is, and because of that, I mean, what you would find if you were trying to be specific within legislation on that particular point, you would maybe be constantly having to amend the regulations. So the regulations are drafted really that similar to the Welsh regulations, and it's
Robert, sorry, with respect, you know, that's why this issue, and again, it was this committee who started digging into this issue when the department and others were saying you have a limited time to do this, and all sorts of penalties will kick in, and the need to get this absolutely right. So it would seem to me that even that lack of clarity in listening to both of you would highlight why it has to be stipulated in the regulations. Because a person could be served with deportation papers and be here for a period of time.
yes, and a person could be served with deportation papers and a failed asylum seeker and go to ground.
And
That person would, if that was the case, they would be served the deportation papers, but their entitlement to free health care would stop.
But this is about getting the regulations clear and having clarity on this. And it seems to me, I mean, I've heard two issues there where it depends, the person will be served with the papers, and that at that point the access stops. And then a few minutes later I heard, oh no, it won't be when the person is served with the papers, it will be when the person leaves. So I'm asking, will the department consider clarifying that in the regulations? And with respect to the Welsh model or any other model, this is about getting our model right.
Yes, and what what I'm thinking is that to be specific in regulations on that point is extremely difficult. As I say, there could be, I mean, if we said that it was up until the point where somebody was served their deportation papers within the legislation, and that there was a period, say, of a couple of months until that person left the country, it wouldn't be right that that person's entitlement to healthcare stopped. If it was in legislation, it would have to. On the other hand, if they were served with their deportation papers and then they sort of disappeared, went to ground, didn't want to move, well, that specific type of person, their entitlement would stop from the time the deportation papers were served. So if to set these various scenarios out in legislation, it really gets quite complicated, and that's why the guidance following the legislation.
What will the regulations say about it?
The legislation will leave it quite simply that anybody that has made an application for asylum will be entitled to, they'll have an entitlement to free primary health care and secondary health care. That's if they've made an application. Doesn't matter whether their application has been approved or been turned down. And that includes all failed asylum seekers, which, if you remember back to 2013, it only really covered the failed asylum seekers.
And does it mention deportation?
No. It doesn't mention it just says that if they've made an application for asylum, so whether that's been accepted or whether it hasn't, they'll still have entitlement. The guidance, and I mean, there has to be guidance surrounding all the other different policy issues being taken forward within the regulations. So the guidance covering the full set of policy changes being taken forward will include the aspect about issuing the issue of deportation papers.
Take over the change orders.
Okay, well look, I mean, I think it'd be important for the committee to see the draft regulations as well.
Sorry?
It would be important to see the draft regulations.
The draft regulations, yeah, and I mean the committee will see the draft regulations. If, for example, the committee were to be content with the policy proposals being taken forward today, which in effect entitles all asylum seekers, whether failed or not, to be entitled to free primary care and secondary care, and it also includes extending the regulations into a primary care setting, which were the two issues really that were a problem initially to the Health Committee. So the regulations will do that. When the regulations are drafted, they'll be at the same time as they are laid. The Health Committee will, and the Examiner Statute Rules will get a copy of them.
Is there not a draft already done?
There's a first draft done, yes.
Well, I mean, could that be shared with the committee?
It's not a finalised draft because there was no point finalising that draft until we came along here to the Health Committee today and yourselves came around and said, yes, we're content.
With respect, in terms of us doing our scrutiny rule as well, we
But there's no
need
problem.
side of
Sure,
this.
following today, yes, when we have a final draft, we're happy to share it with you.
Okay, a final draft. Can we not get a copy of the draft as it stands? Bear in mind that this is a process that we're all engaged on. Okay, so you will share this draft. Thank you. Okay, in terms of the Law Centre, because Stephen, you'd referred to the Law Centre and
Yes.
the consultation, and obviously had raised a number of concerns throughout the process. But I mean, are they now content with this notion of a cut-off point, or in terms of accessing healthcare? Are they content effectively?
During the sort of discussions and consultation with the Northern Ireland Law Centre, I had agreed, yes, that in drafting guidance that they would be fully engaged in it and fully engaged. I mean, the regulations, as I say, would be written in accordance with what would be acceptable to the Northern Ireland Law Centre. So the guidance will also be, drafted in accordance with whatever comments the Northern Ireland Law Centre make, yeah.
But are they content?
Well, obviously, they'll be content, yes, because they'll be signing it off.
Okay, so they will be content, but we're not sure at this point if they are. Okay.
Well, not until the guidance has been drafted.
But on the basis of the direction in terms of what the regulations are stating, yes, the Law Centre are content.
Okay, at Fergal and
Just
Gordon.
two brief comments. Obviously, I guess that the Law Centre might be content with the process. None of us can be content till we really see the final draft. And I would suggest, Chair, if it's appropriate, that we reserve our view of it until we see the final draft. I think that's it. So then we can be content with both the process and the final wording.
Yes, but would the committee not need to be, before I can finalise a draft of the regulations, the health committee would need to be content with the policy implementation, the policy changes that are being taken forward. I can't draft legislation that the health committee isn't content. What we are saying here today is that the legislation is providing free health care for all asylum seekers and failed asylum seekers, and we are saying that it be extended into a primary care setting. Now, if the health committee then is content with those two policy proposals, as well as the rest of the policy proposals, then the legislation there can be a draft prepared and sent to the committee.
I can't speak for the committee, I can only speak for myself, but I'm like 90% of the way there, right? Okay. So, therefore, I would need to see the final 10%.
And I think it's important, Fergal, to point out, we did receive a draft of the original proposals in October on this very issue. So I would expect that we would see a draft now of the revised ones.
But that's not a problem, Chair. We'll get you a copy.
Okay, thank you. Gordon?
Thanks, Chair. Thanks very much, gentlemen, for your presentation. Does this mean that all asylum seekers are now entitled to full health care in Northern Ireland, failed or otherwise?
Yes.
It does, yeah.
It does. So they're now entitled to the same privileges as citizens of Northern Ireland?
Correct.
Yep.
Okay. Have we any idea of the number of people that have come into Northern Ireland and got such treatment within the last 2 years, say?
Figures, I think there's the last roughly about.
For the figures that I had were in relation to 2012.
Yes.
There was 140 asylum applications in 2012. 52 were granted refugee status. So, under the current legislation, they would have been entitled anyway. 25 left the jurisdiction. 35 were refused and were received of Home Office support. Those 35, under the legislation that we proposed back in October, they would have been entitled. And 28 were refused and not in receipt of support. So the legislation as is drafted now, as is proposed to be drafted now, those 28 would fall within the scope of the regulations.
28?
Over a year, yeah.
So roughly 30 people?
Mm-hmm.
Yeah.
So it's not it's not a big, section of people.
Is there a risk, though, that could increase if people came here just to get health treatment?
Well, that was debated sort of at length, prior to that in October. All I can say is, for example, in discussions with Wales, when they amended their legislation to cover all failed asylum seekers, or just all asylum seekers, it wasn't there wasn't a problem of people coming across the border from England or Scotland, into Wales to access that.
It wasn't?
No.
And what's the situation in England?
Situation in England is that all asylum seekers who have made an application are entitled, and all failed asylum seekers who are in receipt of what's known as NASS support are entitled. Failed asylum seekers that aren't in receipt of support have no entitlement. But the position in England is again slightly different from Northern Ireland, because in Northern Ireland, to access primary care, there's the ordinarily resident test to have entitlement. In England, at primary care level, there isn't. So those failed asylum seekers could probably in England have access to primary care, whereas they wouldn't, if we followed the English legislation, they wouldn't have had an entitlement here.
Yeah, they didn't have either.
Yeah, they didn't.
Yeah.
And that would have, you know, that's in relation to preventative measures as well.
Mm-hmm. Just finally, in the Republic of Ireland, what's the situation?
In the Republic, there's it's not as defined. It's very discretionary in terms of asylum seekers. So there's not the same entitlement as I have here. It's more of a discretionary basis. So it's again as and when if it's emergency treatment, but it's not as descriptive as where we're going in terms of a blanket open-ended care for free care for all asylum seekers. So it's on a discretionary basis.
So the UK Health Service is much more accommodating. Thanks very much, Chair.
Thank you, Gordon. Just Mickey first, because you had indicated earlier, and then Roy.
Thanks for the presentation. Now that you've allayed Gordon's fears, we're not going to be overrun with thousands of asylum seekers. My query really is about, I'm not normally cynical by nature, but when I hear about guidance, regulations and guidance, I've been dealing with regulations and legislation for a long time. With guidance, the devil's in the detail, because guidance is open to subjective, often ran objective decisions. So I think it needs to be fairly, I mean, that's one of the big issues with the Welfare Reform Bill. It's enabling legislation. Then you get the regulations, which you don't see apparently until they're in place. And the guidance comes after that, and that allows people in the Social Security Office to say, well, in my opinion, that guidance, I can go along with the guidance, but it's give me options, and therein lies the difficulty. So if you're going to make a decision and people are going to be entitled to healthcare, then I think it has to be very, very clearly stated, not in some kind of sort of guidance which is nebulous. Maybe that's not the right word, but that's in many cases guidance around legislation is nebulous and gives people in positions where they may think they have the power to make those decisions, and they're often subjective. So I have difficulty with that. And if we're going to see regulations, I'd like to see the bill and then the regulations and the guidance, because I don't think we can make any kind of informed decision without being aware of all of that.
In what way?
You know, you're going to be drafting the bill, then the regulations will flow from there.
The regulations will be drafted from the CQ order.
Right, that's okay.
Yeah,
Will we get a chance to see the guidance then as well?
The guidance. I mean, there's a certain, I suppose, importance to get the legislation in place. The guidance will flow from the legislation.
Exactly.
It depends how. And the problem, you know, I'm not meaning to be the problem with this legislation, and I'll certainly give you a draft of the legislation. But I mean, the legislation, the persons not ordinarily resident regulations, it crosses over. I mean, there's the EU directive legislation. There's EC Regulations 883 of 2004, and that is all based on EU legislation. The persons not ordinarily resident regulations, there's like a considerable, say, overlap with those two pieces of legislation. There's then the primary legislation that we're talking about in relation to the persons not ordinary to the ordinarily residence test, and really to look at these look at these regulations in isolation. Well, I mean,
Well, I think you know, we will fulfil that duty, as is our responsibility. You know, we have a statutory duty on us in terms of scrutiny, and I think it would be ill-informed to consider that the committee somehow wouldn't be able to do that. So we were sent the draft regulations in October, and Stephen has confirmed now, I think twice, that we will get access to that. And I think Mickey's absolutely right. It needs to be loud and clear within those regulations, and we'll scrutinise those,
But
as
also
we did
just-
with the previous ones.
Just to the Chair, it goes back to your original point, because unless it's very clearly stated in the bill, then, and it needs to be clear, because then the guidance will flow from that. But if you have guidance which leaves it open to interpretation, and it's not clearly stated, then I think you've got difficulties. And unfortunately, in my experience over many years of dealing with guidance, there's so many interpretations, and some of them are not always beneficial to the person it should be beneficial to. And I think it's important to take note of that.
Well, we'll take that on board. I mean, obviously, as Robert and I have already said, I mean, drafting the guidance will be liaising closely with the Northern Ireland Law Centre and doing that. So obviously they'll make sure that it does. It's very definitive in terms of
Thank you.
its instructions.
Okay, thank you, Mickey. I have Roy next.
Would you accept that we have a difficult balancing act to undertake here, protect the public health against possible infectious diseases? So we need to treat people to avoid others potentially from being infected. There's a degree of compassion of someone who is seeking asylum, but also there's the balance of acting carefully with our limited health resources and the growing waiting lists that do exist here in Northern Ireland. You used earlier the
You didn't think it?
comparison of Wales. Would you accept that, given that our major border, but they're a different country, the Republic of Ireland is a completely different health system and different structure and support, means that Wales may not be a good example?
Possibly, you know, yes, the land border. It was one of the issues that we did raise back in October last year, was the issue of the land border. But I think looking at it in terms of the numbers that Robert sort of presented there a minute ago, in terms of the number of people who are actually actively seeking asylum and those who are refused, we took a view in terms of the overall scale of it. It was quite minimal. And I say, as you quite rightly say, the public health aspect of it is a much more important aspect for the people of Northern Ireland in terms of being able to treat. And whereas if you don't have that access to healthcare as an asylum seeker, you could go to ground, and then it makes it more difficult for you to treat, and it has a much greater impact on the overall population here potentially. So.
As I say, I view it as a difficult balancing act to try and get right. And we may be not far from getting it right, but my question is, what if the guesstimates are not right and a degree of health tourism arises? How can we react to such a situation if it does occur?
Well, if in terms of health tourism, I think it's an issue everywhere at the moment. England, Wales, Scotland, and here,
And Republic of Ireland's where my focus is, because that's where I think we're more likely to perhaps.
And it's an issue that the department and the board are actively aware of. There's access to healthcare team within the BSO was set up to look at, not just in terms of guidance and making sure healthcare service staff are fully aware of what who has a right in terms of access to healthcare, but also how they manage people who are coming in who maybe don't, and how they identify it. But it also looks at how do we identify people who potentially are accessing it, whether fraudulently or illegally, and trying to, when they shouldn't be. And it's that wwhole culture change within the health service is a bigger aspect.
My question is more around our asylum seekers who might, come in through Dublin Airport or wherever. Might they first present themselves in Belfast now rather than Dublin?
I suppose that potentially that is the case, but I know we take the point. The Wales is different from us and doesn't have a land border with another country. But I mean, in terms of the numbers, we just don't feel it'll be, that actively people will decide better to go to Belfast and go and have access to free healthcare. The numbers are quite low. We'll be able to monitor it. We'll be working closely with UKPA. We can keep an eye on the numbers and see what impact it's having in terms of people is the overall level of people who are seeking asylum, is it increasing? So we can monitor and manage it along with ABA and see what impact that has.
So if it's not got right, would it basically a separate
We could look at it.
SLA would be, or SLR be required, or how would it be adjusted if it's not got right?
Well, I mean, again, it would depend on the scale. It would depend on the overall scale. I mean, if the numbers are out, you know, by a massive amount, or there's a huge increase in terms of the level of people who are actively seeking asylum in Northern Ireland as opposed to the Republic, because of the issue of access to healthcare, then we would look at it. It would all be in sort of, as you say, a balancing act and trying to make sure, you know, is that scale of increase, is it what we would have expected? There are other issues around why people are coming here, or is it purely around health? And what is the public health aspect of it if we don't provide free access to healthcare? Will that have a bigger impact than we would have imagined if we just restricted it to those who have applied for asylum and we go back to the way the current legislation sits? So it's really looking at, we would look at it on a not on a case-by-case basis, but in terms of over 1, 2, 3 years, review the situation and have a look and see what are the numbers who are applying for asylum.
And just finally, would it then subsequently require a replacement SLR, or what would be the process to make an adjustment one way or the other?
Well, I suppose, again, it would be, as we have done with this, it would be consultation, go out and have a look at it, see what the implications were of the proposals. If we had to develop a revised SLR, then we would look at that. But again, that would only be on the basis of having identified that there is an increase and it's substantial enough for us to warrant that as a course of action, then we would look at it.
Okay.
Okay, thank you, Roy. Okay, nobody else had indicated. Can I thank you both? I mean, and I do, and I think the committee does appreciate the response from the department to date on this. Again, because I said in the initial comments, the committee had raised a number of issues, both around the secondary care provision and indeed the primary. So we welcome the fact that the department have listened and responded to that, and we appreciate that. However, we do need to be absolutely clear on what's in front of us now, and I think on a number of fronts, particularly side of the regulations.
Okay.
We need to get sight of that before we could take any more steps in that direction.
Okay, we'll make
so
sure you get a call.
Appreciate that. Thank you very much. Okay, members, just in terms of next steps, obviously we've requested the copy of the regulations. Just opposing to members require any further information on this. It may be actually useful also to write to the Law Centre for clarification on their position, that they're content with the revised proposals, and suggesting maybe that members want to schedule this issue for decision next week.
Great,
Comfortable with that? Thank you. Okay, item 8, members, is the Forward Work Programme. I want to advise members again that the last week the committee held a planning meeting to discuss our strategic priorities for 14-15, and the consensus was that our 2 priorities are scrutiny of the department's budget and the scrutiny of transforming your care. In relation to the budget, we agreed to do a piece of work to scrutinise the department's approach to the budget for 2015-16. The committee team will draw up a terms of reference for this piece of work, and we'll begin to take evidence shortly on that. And given, I suppose, that the budget is less than 6 months away, I think it's important that we move on this piece as quickly as possible. In terms of our scrutiny of transforming your care, we agreed to do work to focus on the outcomes of transforming your care, including how those outcomes will be measured and monitored. And we also agreed to examine the workforce planning that's required to implement transforming your care. So we'll begin by doing the piece of work on outcomes with the aim of completing that in this term. The committee team again will draw up terms of reference, and we'll look to appointing a special advisor to assist us with that piece of work. We would aim to start the workforce planning element in January. So are members content with those strategic priorities as outlined?
Great.
Thank you. In relation to the piece of work on transforming your care and the benefits management outcomes framework, the most recent information received by the committee in relation to the framework and the 99 proposals in the Transforming Your Care report was in May of this year. So I'm seeking agreement that we request a further update from the department on those proposals and the management framework. I want also to inform members that Forward Work Programme for the period September to December 2014 is at page 135, and advising members that the programme has been drafted to reflect the outcome of discussions at last week's planning meeting. So I'm asking members, are they now content with the Forward Work Programme?
Great.
Item 9 is matters arising, and page 139 is a copy of the Public Health Agency's information leaflet on ovarian cancer. Do you indicate it, Joanne?
Oh, sorry, Chair.
Yeah, go ahead,
I'm
yeah.
just going to comment. I think no one could have failed to be moved by Una Cruden under her powerful campaign, and I just think I'd like to commend the PHA on this leaflet, and I hope it's widely available, because Una fought such a brilliant campaign and showed true Northern Ireland spirit. And she certainly touched all of us that have met her. So it's great that People Power has worked, and this will be available. Just hope it's widely available across Northern Ireland.
Thank you, Joanne. Pam?
Yeah, thank you, Chair. And just on the back of Joanne's comments, I think it's person power in this case, and in particular. And I'm just wondering, I know we mentioned her last week as well, but did we agree to write to Una or anything to perhaps even acknowledge the work and the input that she obviously has had in this leaflet, because you can see Una's mark just stamped all over it, which is wonderful to see, and I think that we should be commending her and congratulating her for the work she's done and for the outcome that has been achieved through her hard work and determination.
Yeah, absolutely. I would agree to that.
Totally agree. Yeah.
Okay, members, thank you for those comments. Under correspondence, item 10, I want to inform members there's 5 items of correspondence in the meeting folder, and again, in the interest of time, I'm going to draw attention to several of the items. Page 143 is correspondence from the Minister providing reports on emergency care waiting times for the quarters January to March 2014 and April to June 2014. In July, the Minister had announced a task force initiative to improve unscheduled care with the aims of eliminating all avoidable 12-hour waiting time breaches from this winter onward and over the next 18 months.
Great.
Of making significant progress towards achieving the 4-hour waiting time standard. In the correspondence, the Minister has indicated that he will provide a detailed report on the improvement actions emerging from the work of the task group for the quarter ending September 2014. But given that performance in some cases is still falling short of ministerial targets, I think this is an area of concern for the committee. We have scheduled a briefing with the Chief Medical Officer and the Chief Nursing Officer for the 19th of November. So members could maybe note that for their diaries. On page 243 is correspondence from the Minister regarding a copy of the draft adult safeguarding policy, which has been jointly developed with the Department of Justice. The intention is to publish the draft policy for consultation later in the autumn, subject to the views of the relevant committees and the Executive. Want to remind members also that evidence sessions with the Department, the Commissioner for Older People and Professor Williams, which is to be confirmed, on adult safeguarding legislation have been factored into the Forward Work Programme. Want to seek agreement, maybe at this stage, to note the intended consultation and consider draft policy further when the results of the consultation are available, at which time then the committee would have heard from the relevant witnesses. If people are comfortable with that.
Agreed, yeah.
Page 291 is correspondence again from the Minister advising that he has agreed for the Department of Health England to implement on behalf of the North the amendments set out in the General Dental Council Rules Order of Council 2014, which is the legal basis for proposed new continuous professional development requirements. Want to also inform members that the General Dental Council consulted on the draft order between December 13 and March 14, and the majority of the 600 responses were supportive of the proposals. The order would come into force on the 1st of August 2015 for dental care professionals and the 1st of January 2016 for dentists. So I'm asking members to note the correspondence unless any further information or clarification is required.
Right.
Seeking agreement then to note the remaining correspondence unless members have any comments they wish to make. Any other business? Yes, right.
I and a number of others have received correspondence of a tragic nature and issues around the continuing absence of guidance for termination of pregnancy. So I think we should be seeking an update of that from the Minister, and this is badly overdue.
Okay, happy to do that, yes. Okay, item 12 is date, time and place of next meeting. The next committee meeting will be Wednesday, the 24th of September, starting at 2 p.m. in the Senate Chamber Parliament Building.
The Northern Ireland Assembly, Committee Room 20.